Okay, welcome back from the break. And as you probably know, this show, the first 30 minutes was a rerun of a taped version earlier, and the last 30 minutes is a live session. On the bottom of your screen should be the phone number, 727-8750. If you have any questions about the latest Ebola scare, feel free to call in. If you have any questions about anything, again, feel free to call in. I can try and answer the questions as best as possible. As you know, we are getting in the cold and flu season. One of the questions we had a couple of weeks ago was, who should get a flu shot? And probably the answer is anybody who wants one. Certainly if you have a predisposing illness that could make life really difficult for you with influenza, such as diabetes or any chronic diseases, heart disease, anything, a flu vaccine might be a very valuable thing for you. I have a couple people asking me about pneumonia vaccine. Pneumonia vaccines are every 5 years, except for the one after age 65. The reason we do one after age 65, as I've talked about this a lot, is that our immune system becomes somewhat incompetent after age 65 to 70. We lose T cells and those immature T cells that are basically responding to new viral or new antigen loads. And what an antigen is a foreign substance that gets in your body and builds antibodies to protect that. So giving you a live attenuated vaccine or a live virus particle, then you basically build immunity to it. This is a topic that really takes a long time to explain to people, but getting back to something everybody can understand, those patients that were, those doctors and the doctor and the volunteer worker that were treated for Ebola, they were given a monoclonal antibody. What does that mean? Monoclonal means it was an antibody specifically cloned for that particular virus. And so it didn't cross over into anything else. Some of the influenza viruses do have reactivity against other antibodies. So if the antigen, meaning the protein or the virus or whatever the particle is that causes the infection, looks a little bit like something else, an antibody or a protein can attach to that and basically render it inactive. And so therefore, this is the whole premise of the immune system, building up your antibodies to certain bacterial and certainly viral infections. And that goes back to something I said a long time ago, which was this: it didn't matter if you had a bacterial infection. I could soak you in antibiotics and marinate you. The bacteria would eventually overwhelm you. They learn to live in the presence of antibiotics. The only thing that keeps your body from dying from a bacterial infection is an intact immune system, meaning these antibiotics tend to hold it in check until your immune system can come in and cure that. That's why you see the media loves to make news about man at the beach, had strep eating or some strange bacteria from the ocean. Well, he was a diabetic who had an open sore who shouldn't have been in ocean water where it is not clean. I mean, it's a no-brainer. Why would you go there? Why would you do that? But the media makes it like, Galveston or one of these beaches is dirty. But if you read between the lines, you'll understand that if you have a compromised immune system, if you are suffering from cancer, if you do have diabetes, if you do have diseases like COPD and things of that nature, you are less likely to be able to fight off infections, which brings back to the Ebola issue, which is, again, Ebola does seem to do most damage in the young and the old because of the way it works in the immune system. I want to go over a few slides that I had put together, again, just to reiterate a little bit about Ebola. And if they're going to bring those up, I hope they do. But then again, I hope you can see this. Remember, how's that CDC working for you now? I like that statement because remember, the government doesn't work for you. It's always here to clean up a mess afterwards. Remember, Ebola is a class 4 bioagent. It is very deadly in small doses. One virus particle can infect you. And remember that when they actually work with this virus, they're in a positive pressure spacesuit situation. Remember, your local hospital is not prepared to deal with Ebola or Ebola outbreak. We also remember they know how to isolate bacterial and other agents, but they don't have any clue how to isolate a class 4 bioagent. Those are very specific areas. As you know, there are 4 of those in the country, so you know as well as I do, we cannot handle an epidemic of an outbreak. Fortunately, the greatest chance for infection is in the late stages of disease. In the early stages of disease, people are not infectious, but they need to be aware. They should not travel. They should not put the public at risk. And Ebola is a virus bomb, meaning it explodes as the person dies, and this is when people become infected. And now I want to talk a little bit about this deal about the open enrollment. And I want to reiterate that this is the time where you have the ability as a patient, if you're in a Medicare program, to choose your options for where you want for the next year, as far as a HMO or a non-HMO. If you want a non-HMO Medicare, then you have Medicare plus a secondary insurance, and that covers the 20% that Medicare doesn't cover. HMOs, whether it being Senior Dimensions or Humana, they are a closed model. This is a picture of what a Senior Dimensions cap model looks like. It's just one of those cap models out there. There are a lot of models for this. Remember, the government now pays a health care plan to administer your benefits. You are not in charge of those anymore. The health plan is. They actually tell you who you can see, when you can see them, and they monitor those programs. The benefit are that you do not have a 20% copay. You do not have to buy a secondary policy. If you stay within that plan, most of your expenses are covered. They do have some copays associated with some testing. They do make exceptions. You have to read the manual very, very carefully. Let's go back to that Senior Dimensions, and I'll try and explain with my mouse here. Remember, what they do is the money over here is coming in from Medicare, which I don't know if you can see this. It goes into the health plan administrative fund, and then they pay everybody a set fee per month to take care of those patients, okay? So they may get so much per patient, whether it be $1, $2, you know, but they have to provide that care for their membership. So that's why if you come to see me in a Senior Dimensions and you need to see the dermatologist, I'm going to refer you to the dermatologist, and that's going to be who you're going to go see in that plan. You are able to go outside the plan, but you are going to pay fee for service for that if that's what you want to do. They have a prescription plan associated with this. They have a lot of different things, but this kind of Senior Dimensions cap is not, even though it's a closed system, it's not as closed as the Humana IPA model, which is the next slide, and that basically is, if you can see what this represents, is a umbrella, even though that's a poor umbrella. But what happens in this model is they are in a risk sharing model. They share the risk with the insurance company. In the other one, there is no risk shared with the providers. They don't win or lose depending on how your outcome comes. This plan does win or lose depending on the outcome of your health care, meaning that they have to cover $30,000 of the first of your expenses. After that, Humana kicks in that. When they don't spend that money, if you don't go to the hospital, if you don't spend a lot of that money in that plan, they get a nice big bonus down here in the bottom for managing your care. So a plan that it somewhat incentivizes patients or doctors to somewhat restrict care, even though that is a very bad term. Nobody really ever restricts care, but sometimes it's often hard when you mix money and care at the same time. When you do that, that tends to be a kind of area. And so remember that healthcare partners and that particular IPA, they own their doctors. They are employees of that plan. Southwest Medical doctors are an employee of Southwest Medical, which is a clinic not owned by and somewhat an IPA. They are basically their own separate entity, but they do try to keep things closed and referred into certain things. So if you're one of these people that likes to travel, if you're one of these people that likes to choose your doctor and like to have the independence, like we are, we're the independent medical group. We take senior dimensions. We do not deal with Humana. Straight Medicare might be a better option for you, but I encourage you to visit the carriers. I encourage you to talk to the people who you're thinking about doing business with. Ask questions. Find out if this plan is for you. And with no further ado, I will say good night and keep yourself safe, and watch the news for the latest Ebola issues. So thank you for tuning in tonight, Pahrump. Have a great night.